And now it's an honor to introduce Dr. Jordi Serrano, Global Advisor for Innovation and Research at Sant Joan de Déu, Barcelona Children's Hospital, and co-founder of Paediatric Health. We have more of an introduction. You can come up. It's long here.
Yeah.
Well, Dr. Serrano is a global consultant in innovation and research, advising hospitals, governments, and international organizations. A specialist in family medicine, he has founded several digital health companies born directly from clinical needs, including UniversalDoctor, UhDa Health, recognized as one of Europe's top 50 digital health innovators. He recently launched Paediatric Health, a personalized prevention program, as well as the nonprofit Planetary Health Innovation Network. Today, he will share his keynote, Advancing Pediatric Innovation and Research Through a Planetary Health Lens. Now, you can please join me in welcoming Dr. Jordi Serrano to the stage.
Thank you. So, thank you very much, and thank you, Sant Joan de Déu for Kids and all the team. It's a pleasure to collaborate, to work with you, and congratulations for being a classical already. Imagine you are commanding Star Trek Starcruise. You would love to have a QR of the situation of the planet, wouldn't you? Do you know if it's already there, that QR? It is. It's simple. We have 9 boundaries, and we are almost crossing 7 of them. The most critical one is ocean acidification, and it could be a big, big trigger. Be honest, whom of you knew about these barriers? 7, 8 people in a healthcare environment. So it's important. It's important to really know about that without being catastrophic, but it's important to keep going. So we have a QR, and we are crossing all the levels. Our children will never see again this frog, of course. It's a frog from Costa Rica, disappeared in 1999. And of course, you know that the bugs now, it's not, you know, that many pathologists used to test the rats next to a hospital. Now it's not only rats. We must test everywhere. And of course, most of our children will never see the stars again. And many children in the world live here. So with all that, it's important, sorry about that, it's important to understand why people migrate, why people in many low-income countries are really have the need to go to other countries, and why we have to take care of them. We are part of this planet. This is clear, but we have to remember that every day. And of course, of the 9 barriers, it's not only heat waves, climate change in general. It's many things, okay? And many of these things affect our children, maternal and child health in general, and even ourselves when we are older. And it's important to understand the concept of exposome. We'll go later, but more and more and more, we are not alone in silos, in our specialty, in our work. We must be totally united. This is my city, that's why I'm putting it, and I lived many years here in Gran Via next, and I went to my college, my institute. I was walking, no? And when I was very little, in Sabadell, I used to listen the textile factories. There's a noise that always reminds me, you know, my city. They all disappeared in 1 year, by the way, 1992, 1993. But I never imagined I had been breathing all these years above the pollution, no, recommended by WHO, of course, by even European Union. So we lose many years of life, okay? And that's said by the politician of Sabadell, and that's nice that politicians get involved with that. I'm a family doctor. I've been always very hyperactive. I didn't fit with the system when I was 28, 29, but I did it in a nice way. So I started to set up some companies. Now it's easy. It's easy to have, not easy, but now you are a company by accelerator program and so on. In 2006, somebody called me, Jordi, are you okay? Are you okay? Because after 12 years of studying, why are you doing these companies? Well, it's always the feeling of doing things, no? But basically, I moved in, I set up UniversalDoctor, I moved to Geneva, I wanted to work with WHO, was my dream. because of different circumstances, I could work, and then Ebola, Zika, all the pandemics came, and I was involved in many digital health projects around the world. And that's why some people sometimes, oh, Jordi, but you do 37 things. It's not true, okay? My company used to do many things, but with many people in that sense. And slowly, I kept moving, and for example, now we have set up a nonprofit called Planetary Health Innovation, which we will speak later. Working with all the institutions along all these years, it's been a pleasure. And basically now, also, for the last year, I've been collaborating, working with the St. Joan Children's Barcelona Hospital, Sant Joan de Déu. It's a pleasure for a person who loves innovation to work in that hospital. It's like the jewel of the crown for innovation in many aspects. It's not because I'm working now there. I'm quite direct in these things. I think we have to keep it, and keeping the collaborations with all the other centers, of course. And of course, the team, sorry it's not updated the photo, but many people are missing. But thank you to the team and allowing me to do what I love the most, is cross the hospital all around, always knocking the door to many people. This is what I love the most, and I'm really happy that you allow me to do that. Remember, this photo, 1911, that proves that vaccines work, of course. It's simple, okay? An image is clear, no? I am a fanatic of National Geographic. I have all the collection since 1962. No, I went to buy everywhere. And I always remember this, and I thought, well, it's important, but it's not so important. It's clear that we call it plastic placenta already, placenta. In Italian, the investigators have found plastics everywhere, okay? And it's important to understand what is coming. And in the national plans, we don't consider children. They're not actions to really mitigate the effects of all these components and so on and so on. So that's a big problem. And just a reminder to everybody, many of you here, very well-known faces, you know very well these differences. There shouldn't be, from my point of view, global health, One Health, planetary health, there is an overlap. The important thing is that we have resources and researchers and implementers of all these fields, And that's why we created Planetary Innovation, to support innovation in the three fields. But basically, the difference between One Health and planetary health, if somebody does not understand it initially, One Health, we have the veterinary, so the animal health, the human health, the connections, and planetary health is the extension of the ecosystem, And we are very involved in that. That is fantastic graphic. Two days of family doctors and cardiologists working together a weekend 5 years ago. It's very old, but it's not so old. But 5 years ago, it's old. And the important thing is how exponentially you can find here exome sequencing, or you could have microRNA or whatever, And linking it with natural language processing. It means that a student of Diagonal UPC, a Polytechnical University, never thought when he entered into that university that would end at the other part of the diagonal in the CRG, using the algorithms for the letters of life, timina, guanina. It has happened many times. So this is the key of these technologies, all exponential together, and this is why it's so powerful in that sense. To that, we add this other layer. This is then bigger and bigger, and of course, this is something, a concept that we have to, of course, IS Global, Dr. Plasencia was the former director of IS Global, and this concept is to understand the exposition to environment, to your home, if you are not able to pay on the 26th of every month to your employees, you have a higher level of cytokines. That's clear. That's determinants of life, okay? So, social determinants of health, sorry. So all that together is the exposome. And slowly, in the clinical history, we'll have all these things, or we should have all these things, And this is it's a must. So with that, we have opportunities of systematic integration. 30% of things that are done in healthcare are useless, are redundant, and not only that, we could save a lot of money, but then there are not opportunities of integration. This is the election days of the Bolivian people in Bolivia. When they went to vote, some very clever people here used that day to screen Chagas disease. That is a systematic, the screening integration opportunity done. 16% of them had Chagas disease, and we didn't know. So this is the capacity to do that. If you are a family doctor and a Bolivian visits you, you must understand that a screening of Chagas must be done if it hasn't been done before. So like that, there are hundreds of opportunities that altogether, it's what is changing everything. Data of space, European Space Agency, it's free. Everybody can use it. No? This is another project of IS Global, no? The mortality in the heat waves on summer. Connection, it's not us, it's not me, it's the Lancet that says, look, be prepared. In the days of dryness, have cardiologists. In the days of humidity, have pneumology. So you should have all that planning ahead. This is a project of neglected diseases. One of my collaborations with WHO, or collaborations with WHO, the important thing was collaboration. We did an AI algorithm to really take care of, or just to diagnose neglected skin disease of the skin, ulcera buruli, lepra, that not so many doctors now know how to diagnose them. It was a big barrier not to have the right photographies. And until we sit down with many institutions and we say we do not continue until we collaborate, it didn't take off. It's not interoperability technically anymore. It's interoperability between persons, but it's really difficult. So, innovation from that side of the puzzle. Here in the hospital, no, we have Dr. Elena Codina and the team, Ariane now and others, that have set up that unit. This is called Paediatric Environmental Health Unit. Okay? That was born many years ago in the States, and basically it's not been there so quite successful as it could be in Europe, as you can imagine, for many reasons. We don't have time. But because it has been taken from an epidemiological point of view there, and they have difficulties with implementing real projects in the States. But here we have a huge opportunity to work together, make synergies, and a unit like that can work with all these specialties transversally. This is what I love the most. And really, many projects can be done. Follow-up oncological patients. No? More and more visits are done to people who are asking you, my child has had a cancer. Can I live 5 kilometers away from the Tarragona industrial field? Well, they're not professional enough to understand all these concepts and to give an answer. I am painting the walls of my home with this painter. I have allergy. I have asthma. There is pollution in my city. All that together, there is nobody that gives that consultation, no, to the patients. So slowly, I vaticinate, oh, this is my bet. In 5-10 years, we'll be doctors only dedicated to that. Being visited by fathers, by parents, by ourselves. I have allergy, there is pollution, how can I survive in that sense? So all that makes these pediatric environmental health units as a power inside the hospitals, and it's necessary to move. But we need, of course, we need to know the data. Inside the hospital, sometimes it's difficult, of course, it's logical, but also in the homes. And there's some projects that can be done, innovation researches, about the data in that sense. They call it the indoor generation. Children that do not get out. This is terrible for many reasons, you know. But it can be really terrible. You are in a bubble, okay? And what has been done? The hospital, Dr. Elena Codina and others, have implemented UhDa project at homes with a wonderful sensor. And we know that the pollution at home is worse than in the street. Okay? And this is just starting. It doesn't mean that the triggers, in adults it hasn't been proved, because maybe the COPD people are so exacerbated that it doesn't make a difference. But in children it seems yes. And that control, it's fantastic, because as you know, that super hospital has 300 kids at home. And this is the liquid hospital. So we have to have good control of these people. And this is fantastic. And of course, you know, this is the fantastic cortex of the hospital. Later, the director of data, Yolima, will be here. And the capacity with this process is amazing. So we have to incorporate all that, and they are already thinking in doing that, incorporating the data. I reached a European project, many opportunities. European Union is proposing many calls in the next years with this concept Planetary Health, of course, but also trying to find risk evaluations of different exposome to different cancers. You know that this is very difficult to assess if some cancers, the onset of some cancers really rely on these aspects or not, and there is a lot we will be discussing during ours. But it's important to really ratify it, or at least the follow-up of these cancers, have them in mind. So we ask for this project. We hope we can win it. And we can collaborate with everybody that we are working. Imagine all these institutions, many big hospitals in Europe, et cetera, et cetera. I think it's very important. But the systems must be prepared. A data federation space, interoperability, and obviously the use of these things on the daily basis. And what happened? We don't have much time. It's important to implement the green clinical history. It shouldn't be called anymore, it's called green because it was done like that many years ago. But we should have time. And there are opportunities, we'll talk later, very quickly later, with the new technologies, because people don't have time to even ask for tobacco. This is very grave. And this is where I must to be honest. So not to mention all the other opportunities to be asked. No? With the new technologies, we can ask all these things. Third-hand smoke. Who knows who is third-hand smoke? Okay. When you smoke at home, no, and you go to the hospital, it's not second-hand smoke that you are sitting in a terrace and somebody. This is second-hand. Third-hand smoke, you have some nitrates, other substances in your trousers, and you enter in the hospital with that. You go to the corner to smoke, and you enter into the hospital with that. There is huge evidence that that causes big problems towards children. So it's important to have all these things in mind and to understand that yourself prescribing medication, you can have an attitude of green prescription or not. I'm asthmatic, so I know which inhaler is the equivalent of me driving to Andorra. And I would prefer somebody prescribing me another inhaler. So this is all, many things that can be done. It's very important. Hospital Universitari of Mollet. This is a partner of us, of course, and this hospital, it's been amazing, built 10 years ago, 12 years ago, and it could be done that way. But it's also the leadership that has supported that. No? They are the Green Hospital, and the first hospital being awarded a Joan Commission in that sense. Many hospitals in the world have joined with the Global Green and Healthy Hospitals, and any of your hospitals can join all these possibilities. Born in generation, basically to have, ICUs without plastics, etc., etc. There are many opportunities and environmental impact. Some of you could say, if the residents are not learning enough, each ChatGPT search consumes more than anything else. Please print again paper. It's happening in some places, okay? So ChatGPT consumes a lot of things. But of course, if we do telemedicine, we can compensate all these things. Real-time genomics, in the middle of a country without good infrastructure, you can do with Nanopore, One Health Genomics, and this is very important, for just $700. And of course, digital exposome. We knew that in some neighborhoods before, things happen, but now we can measure them. With a sensor, we know exactly how you feel in your neighborhood, et cetera, et cetera. This is very important. Just, it's not advertising, because, but of course, a little bit. But my colleague Elena Codina did a book, 1,000 Days book, okay? The first 1,000 days are the critical ones. These days are the ones where you will be configured. We have to take care of you. And it was displayed in this library in Barcelona next to a book I launched 2 weeks ago. I'm very happy. So what happened? Why I wrote this book? Because it's clear what is happening. Many years ago, there has been many of these challenges facing all ones, as always, and the last ones, new ones, aging and climate-related things. But what happened? The solutions are slowly being implemented. And more importantly, we have to change the role. We have to have a proactive hospital, really proactive, and pediatrics in that can be very good. With all this mess of new terms of technology, all the things can be done. Hospital, green hospitals, etc. And basically, if doctors and nurses do not want to make the anamnesis, We have now technology can do it. In 5 years, it should be forbidden not to have all the green history with our patients because it's a missing opportunity. There are no pathologies. We have to really share all that, and we go to that sense, to that medicine, to the learning models. Just to talk about values care very quickly, 1 minute, last minute. Your specialty, okay? Last week, FDA published this N1 platform, okay? The concept of there has been in CHOP Hospital an N1 cure with editing. That will revolutionize everything, and you as pediatricians and hospitals, like all these parents that are heroes, these adventures, they have to do all these things to finally try to cure their babies. Understanding the cost effectiveness and everything, governments should accept that basically the ethical dilemma of the rare disease is not an ethical dilemma. We should keep pushing because that will really deliver a lot of increase of quality and science. Very quickly, the people of Qatar, Children's Hospital are here. Thank you. They're doing new things with metabolomics. This is very important. And we could talk about many things. I'm out of the time, so sorry about that. But 30 seconds. I cannot stop making business, you know that. So I'm an entrepreneur. I should have a very quick company, PA Health. It's only weekends, so it's not incompatible. And we're doing visits during 2 hours where people are really explaining themselves about prevention, prediction, etc. And finally, the nonprofit, Planetary Innovation Network. We really did so 2 conferences. This woman, Sara Soto, this is an amazing specialist in antibiotics. She has a TED Kiss. What is missing is investors. I see 3 here. To invest in One Health, Planetary Health, and Global Health. Because if not, maybe in 2-3 years, we will not have the planet in 20 years. So there will be not investors anyway. So basically, to finish, that was in Rome, a vision for the future. I see in 25 years, this is my daughter. She was born 4 months ago, and I see her. She will do what she wants to do. I don't want to say, but I see her being a doctor in the intensive care unit, using all the technologies, decentralized hospital, AI intelligence, and basically the most important thing, the prevention is the king. The director of the hospital will be a preventive director. So thank you very much, and thank you, i4Kids, for everything. Thank you.
Thank you very much, Dr. Serrano, for that inspiring keynote and for reminding us how closely planetary health and pediatric health are intertwined.